Hi, in this video, I'm going to be talking about metastatic breast cancer, what it is, how it's diagnosed, and how we treat it. First of all, what is metastatic breast cancer? We have a lot of content about different types of treatment and different types of side effects associated with advanced breast cancer. I'd love you to check those out and subscribe to our channel because we're always putting out new content. So metastatic refers to cancer that has spread from the primary site, in this case the breast, to other parts of the body, not the lymph nodes. The lymph nodes are regional disease. So it's kind of puzzling when people see their pathology report and the lymph node has a metastasis in it. That's not what oncologists mean when we talk about metastatic breast cancer. We're talking about breast cancer cells that have escaped the breast tumor and spread through the bloodstream and the lymphatics to other parts of the body. They can lie dormant and then wake up again in other parts of the body: liver, lung, bone, less commonly brain. The cancer cells can go nearly anywhere, but those are the most common sites. And again, if you were diagnosed with breast cancer and then the breast cancer comes back, those cells were there at the time of your primary diagnosis, and the treatment you had kept those cells asleep all this time. The hope is, of course, again, to get them under control. That's the purpose of treatment, is to control the disease. When we talk about metastatic disease, there are a couple things I'd like to clarify. The first is that you can be diagnosed at the very time you find out you have breast cancer with disease in other parts of your body. You might hear this called de novo metastatic disease, but this is also stage 4 disease. People don't go from stage 1 to stage 4, or stage 2 to stage 4, or stage 3 to stage 4. Stage 4 refers to only being diagnosed with breast cancer in other parts of the body at the very same time you're told you have breast cancer. So I'm hoping that's helpful. It's really a sort of terminology difference. And then the other point I want to make is that we can have other kinds of recurrence besides metastatic recurrence. So if the cancer comes back in the breast or the lymph nodes on that side of the breast, that side of the body, that's a local regional recurrence. And yes, we will do scans to see if it's gone to other parts of the body. But the goal of treatment, if it hasn't gone to other parts of the body, is cure, just like it was when you were first diagnosed. So it's important to distinguish when you hear somebody's had a recurrence. Was it a local regional recurrence? Was it in the breast or the lymph nodes where it was before? Or is it in other parts of the body? And in your case, if doctors say you have a recurrence of your cancer, you want to ask them, where is it in the body? What parts of my body can you see the cancer? And just get it all out on the table so you're not going to be surprised later. Of course, down the road, the cancer can grow in other parts of the body, and you'll want to be informed with anything that changes. I'm not going to go into how this happens, how this process happens, but cancer cells are really wily, and they know how to spread to other parts of the body. That's why we give treatment in early stage disease, because we want to decrease the chance of that happening. We'd like to do everything we can to make sure that the cancer doesn't come back. So how do we diagnose metastatic cancer? The most common way is that people have symptoms. So if the cancer's in the bone, people have bone pain. And this is different from joint pain that you might have with endocrine therapy. This is really in the bone, the femur, the back, the hip bone, the upper arm. Usually breast cancer does not spread below the elbow or below the knees unless it's in other parts of the body. Widespread bone metastases can show up in the lower arm or in the lower leg. But in general, an ankle pain, for example, or pain in the shin is not related to metastatic breast cancer. The cancer cells seem to like to go where the bone marrow is, which are all those areas I mentioned: the hip, the thigh, the back, sometimes the ribs. There's a lot of bone marrow in the ribs, and the cancer cells sort of set up shop there. If people have cancer in their liver, they can present with jaundice. They might be yellowing of the skin or the eyes, or they may even have pain in the right upper quadrant, which is on the right side in the upper part of the abdomen. That's when the cancer is quite extensive in the liver. The liver doesn't really feel things until there's a lot of involvement. People can also present or show up, that's just jargon for showing up, with lung symptoms. So they might have cough or shortness of breath or chest pain with taking in a breath. It's not usually pain over the heart. We want to make sure we don't confuse people in terms of heart condition versus pain in the ribs, for example, or pain with taking a deep breath. All of those things, if they last more than a couple days, are worth talking about with your medical team. People with brain metastases tend to show up with headache or seizures or balance problems, depending on where the cancer is in the brain. I'm going to just do a little aside and say, again, if you have symptoms and you're not sure if it's worth calling your medical team about, I would encourage you to do so. I generally say if they've been there for 5 days or more, give a call. First of all, wouldn't it be nice to connect with somebody who knows your story and knows what might be going on? And if it's nothing, it's nothing. And you've actually made the day of the person you talked with on the phone. I also don't like people waiting over a weekend. So if it's been 4 days and it's a Friday, give a call in the morning. In general, calling on a Friday afternoon, as you are probably well aware, decreases the chance of you getting a call. Most of the things that you'll feel after breast cancer are not related to metastases. So I want to reassure you that most of those aches and pains that you have are not signs that the cancer is coming back. Most of the time, people do know they have metastatic disease. It's not usually found by accident. But there are a certain proportion of people who will be getting a chest x-ray for another reason, because they have a fever and a cough and producing a lot of yuck, and somebody wants to make sure they don't have pneumonia, and we might see something that we then evaluate and find out is cancer. In general, we try to biopsy anything we're worried about. And it's very useful to confirm, number one, that this is cancer. If it's cancer, to confirm it's the breast cancer. And if it's breast cancer, to know more about the tumor in terms of, does it have the estrogen and progesterone receptors? Is it HER2 positive? You can read about all those things in our other videos. You can watch and learn more about those things in our other videos. So we do like to do a biopsy whenever it's possible. There are some times we don't need to. If the cancers come back on the chest wall following a mastectomy, we can be pretty certain that it's breast cancer and biopsy that, so we don't have to do a biopsy of the lung or the liver or the bone, for example. But in general, we do try to get what's called tissue confirmation that this is metastatic disease and learn as much about it as possible. In addition, there's some mutations we like to test for in the tumor, not in the person, but in the tumor itself, because we're getting more and more treatments that target specific mutations. So I'm not going to go into those in detail, but that's the reason we want to do a biopsy if a biopsy is offered to you. And if you're not offered a biopsy, it's a very reasonable question to ask, should I have a biopsy of this area? So we talk about tissue confirmation after scans, and we try to put that together with your whole story. In terms of treatment, which I'd like to cover next, the treatment is based on a whole host of factors. It's based on how many symptoms you're having. What did the tumor look like? Is it estrogen and progesterone receptor positive or negative? Is it HER2 positive or negative? What treatment are you on right now? If you're on endocrine treatment right now, we'll switch you to a different endocrine treatment, for example. If you just finished chemotherapy and it's found that your cancer is in other parts of the body, we're going to probably switch you to a different chemotherapy. We use chemotherapy, targeted therapy, endocrine therapy. If cancer's in the bone, we use bone strengthening medications like bisphosphonates or the rank ligand inhibitors spelled out below. We can also use radiation therapy to treat disease in other parts of the body, especially if there are symptoms or if we're worried if we don't, something bad will happen. Radiation works very quickly. So if we're worried, you don't have pain in your femur, but we've seen something there and it looks like it could break, we will radiate that earlier rather than later. Some people will also have surgery for metastatic breast cancer, although that is not the mainstay of treatment. The main form of treatment in advanced breast cancer is not surgery. We are treating disease that's spread to other parts of the body. This doesn't mean you can't have surgery, but it's not the priority. We want to confirm that the disease in the other parts of the body is responding to treatment before we put you through an operation. There are, of course, exceptions. As I mentioned, your femur might look like it's about to break. You may be offered a rod. That's a surgery done by an orthopedist who puts a rod in the femur, and then you would get radiation. That's to prevent a fracture. And then, of course, there are times when people have, acute emergencies that will benefit from surgery, like spinal cord compression or brain metastases, for which we'll do surgery. But in general, surgery is not the mainstay. We want to treat the whole system first, unless there's an emergency. I've covered a lot. This is really heavy stuff. I hope it's been helpful. If you've been going through treatment for metastatic breast cancer, drop a comment below and let us know how you're doing to help the other people who are watching this video, derive some strength from your experience. We always appreciate your comments. Although we can't give medical advice, we can answer questions in general. And I want to thank you for watching.